Welcome to the CAH and DSD database. This session will describe how to view, edit and add clinical data or a clinical episode to a patient. Now that we've entered a patient, we can select this patient either via his or her surname, hospital number, date of birth, or the main diagnosis, or by a clinic date if there's a clinic date entered. Another easy way is to go down here to the select patient drop down menu, and it's Tony Tester popping up. We can press the button here, which is self-explanatory, to view, edit, add patients and clinical data. After we press this button, this form holding most of the information within the database appears. And it starts with clinical visit investigation. We can also look at patient details. We can look at history, DSD history and biobanking, hospital and surgery, genetics and imaging. In this session here we will look at the clinical visit and the investigation. To add a new visit, we can here enter the data, the date, and unlock the rest of the form. Currently the entire form is locked, so we enter it. Let's see, patient has been seen by myself in the general endocrine clinic and will be followed up in the general endocrine clinic in 3 months. And we will require this information for an automated output afterwards. So this patient is now 10 years old. Let's say he's 150 centimeters and about 50 kilograms. And then we can go along entering blood pressure and all other clinical data which is required on this form, including pubertal staging and testicular volume. So if the patient is on glucocorticoids, there are different glucocorticoids to choose from, such as hydrocortisone, prednisone, and dexamethasone. We can enter the doses here and see if they're appropriate. Ideally, for audit purposes, we will also enter the time when the glucocorticoids are given, as this will allow for better audit. Patients on fludrocortisone, we also add a fludrocortisone dose, ideally also with the time. And then we can go up here on the calculation button and see how much glucocorticoid and mineralocorticoid the patient per meter square and day is on. So it seems to be appropriate doses. This is the height and weight. It calculates the BMI and body surface area. If we decide to change a dose, then let's say we're not happy with the 2.5 in the evening and we want to increase it. We want to increase it to, let's say, 5. We have to enter the times again just for security purposes, and that is it. As we also want to conduct an audit at the moment, we ask for the emergency kit. The patient has an emergency kit, has received training and has some knowledge. They want a steroid card in this case. Can choose, the patient has it at the visit. Probably, and looking at medical alert bracelets if they're owned and present at the visit. So after we fill in all this information, we can also look at the dose of hydrocortisone, the new dose, and we're happy with then getting it up to 12 milligrams per meter square. So then we have some clinical comments. We usually enter on examination, patient is well, system is fine, no problems. There's no other medication. You can add other medication such as the type of it and different preparations. And next step, biochemistry, we can take planned investigations for this patient. In this case we choose 1700p androstenedione, iron, testosterone, user age, renin, and patient's due bone age. So, and that is it in terms of required data for this visit. So we can then go up here into this area where you can see quite a few different buttons, such as CAH summary, salt wasting summary, DSD summary. This is a patient with CAH. So we press this button, computer calculates and generates an automated output of the clinical summary, all the data we've just entered and just showed to you here in the print preview in Word, with all the information available. We can just print it out, sign it and stick it in the notes. I close Word here for a second. And the advantage here is, because we've done a dose change which we want to communicate immediately to GP, you can also press on a short letter which is also printed out in clinic, signed and given to the patient with some basic information, and we will follow up with a clinic letter. And secondly, all the data, or thirdly, all the data are available for a clinic letter. We haven't entered a GP, but all the data are available for the clinic letter, which also shortens and improves time for our secretarial stuff. So I hope I've shown you how we enter the data and how data are processed, and see you at the next session.